Sudden loss of vision, frightening symptom for patients, represent an ongoing issue or only be temporarily. The term transient monocular visual loss describes a sudden transient loss of vision that lasts less than 24 hours. Common causes of sudden painless loss of vision can be ischemic or vascular, that is thrombosis, embolism, temporal arteritis, etc. This includes recognized syndromes, that is occlusion of central artery vein, central retinal vein, and occlusion of central retinal artery, vitreous hemorrhage, retinal attachment, retinal migraine. Ischemic or vascular, often referred to as amaurosis fugax. Wide differential include large artery disease, that is atherothrombosis, embolus, dissection, small artery occlusive disease, that is anterior ischemic optic neuropathy, vasculitis, that is temporal arteritis, venous disease, and hypoperfusion. May represent a form of transient ischemic attack. It should either be treated in a similar fashion with aspirin 300 mg being given. Altitudinal field effects are often seen. Curtain coming down. Ischemic optic neuropathy is due to occlusion of the short posterior ciliary arteries causing damage to optic nerve. Central retinal vein occlusion incidence increases with age. More common than arterial occlusion, causes glaucoma, polycythemia, hypertension. Severe retinal hemorrhages are usually seen on fundoscopy. Central retinal artery occlusion due to thromboembolism from atherosclerosis or arteritis, that is temporal arteritis. Features include afferent pupillary defect, cherry red spot on a pale retina. Vitreous hemorrhage causes diabetes, bleeding disorder, anticoagulants. Features may include sudden visual loss or dark spots. Retinal detachment. Features of vitreous detachment which may precede renal detachment include flashes of light or floaters. Posterior vitreous detachment, there are flashes of light, photopsia in the peripheral field of vision, floaters, often on the temporal side of the central vision. Retinal attachment, dense shadow that starts peripherally, progress towards the central vision. A veil of curtain over the field of vision, straight lines appear curved. Central visual loss. Vitreous hemorrhage, large bleeds cause sudden visual loss. Moderate bleed may be described as numerous dark spots. Small bleeds may cause floaters.